When we're talking about the physiological effect of thyroid hormone, we should know that the thyroid hormone exert its main effect through the receptors that are placed inside the nucleus. Inside the nucleus, the thyroid hormone will bind to its receptor, and a complex of the thyroid hormone receptor plus hormone and some element that are some cofactor that are added to each other will affect the gene expression by recruitment of coactivator or co-repressors, and affect the gene expression. And these genes are expressed, and for this reason, there are some of the effect of thyroid hormone a little uh, uh, are a little um, take a little time to be seen. This figure show the how the thyroid hormone should affect the uh, effect should affect the cell. As you see, it entered firstly. It entered the cell. T4 entered the cell. Inside the cell, it is converted into T3 by the iodinase, and then T3 will enter the nucleus. In the nucleus, this complex that I told you will form, and then the genes will be transcribed, and gene transcription will happen, and then synthesis of new protein will happen. When these protein are produced, now those effects that we know about thyroid hormone, such as growth, such as CNS development, cardiovascular effect, metabolic effect, and effect that it has on many other cells, will be generated. These effect of thyroid hormone are named as non-genomic, the genomic effect of the thyroid hormone. But we know that there are some non-genomic effect for the thyroid hormone that are less considered and less important for the cell. Therefore, here I am going to review the most important effect of thyroid hormone. Thyroid hormone is well known and best known for its effect on metabolism and basal metabolic rate. It is completely known that T3, as the active form of the hormone, activate the transport of iron through the channel, the size of mitochondria, the total membrane surface area of mitochondria, and the activity of mitochondria will be increased by the thyroid hormone. And all these effects will increase the rate of ATP production and also the usage of the ATP. For this reason, if you want to evaluate the function of thyroid hormone, the best way is to evaluate the basal metabolic rate, how much of oxygen is used by the body, and this is one criteria for the function of the thyroid hormone, because the mitochondria is one of the most important target in the cell that is affected by thyroid gland. And this figure show how thyroid hormones indirectly, by changing some genes from gene expression, or directly, even it has the direct effect on mitochondria, and therefore affect the mitochondrial function. Uh, when we say that thyroid hormone affect basal metabolic rate, we should know that it increase uncoupling receptors, increase oxygen consumption, protein synthesis, it increase uh, requirement for vitamins. uh, in low concentration, it decreases protein catabolism, and mainly thyroid hormone stimulate protein synthesis. But we should know that in very high levels, it can do the reverse and even use the proteins as energy source. But normally, it stimulates the protein synthesis. In the lipid tissues, in the adipose tissue, uh, thyroid hormone stimulate the mobilization of lipid and from the fat tissue, and therefore increase free fatty acid concentration in the blood. Why? Because it is used to be as energy source. On the other hand, you can see that it increased the clearance of the chylomicron, decreased LDL level in the blood, and decreased the cholesterol and phospholipid and triglyceride in the plasma because they are used as energy source. In addition to these effects that I told you, T3 also stimulate the glycolysis and glyconeogenesis, and also uh, increased absorption of glucose from the GI system. This means that the glucose concentration is increased to be used as an energy source. Thyroid hormone also stimulate insulin secretion because of the high glucose concentration, and this high level of insulin allow the cell to absorb more glucose and use these glucose as energy source. Also, not only the glucose is affected by insulin and the process that I told you, the hormones that affect the metabolism of the glucose is also affected by thyroid hormones, such as growth hormones, such as glucagon, epinephrine, norepinephrine. These all effects show that thyroid hormone is a regulator for the metabolism of carbohydrate also. In the level of the cells of the body and different tissues, we know that those effects that I told you are essential for the growth of and maturation. We know that during the embryonic life and then after the birth, during the developmental age, the presence of thyroid hormone is essential for the growth. You remember I told you in the part that we had about the growth, and I told you that the thyroid hormone is an essential part of the physiology of growth. And we know, particularly in the embryonic life and after the birth, normal thyroid hormone concentration is required, not only for the body but also for the brain. We know that brain developments have different criteria, different levels of the brain development, such as myelination, differentiation of neuronal glial cell, and migration of these cells depend on normal level of thyroid hormone. And for this reason, if we had a embryonic life, we have in the embryonic life, we have a problem in the production of the thyroid hormone, then the maturation will be undermined. During the embryonic life, even if the baby has not enough, do not produce enough thyroid hormone, the thyroid hormone will be provided by the mother. Therefore, there is no problem during the embryonic life. But after the birth, if thyroid hormone was not produced by the baby, therefore the maturation will be affected severely. This figure show the timeline that show the timeline of the thyroid hormone expression and function. And as you see, from the early life, in the embryonic life, even less than 5 weeks of the gestational life, thyroid gland develop and start to produce the hormone. And as you see, from the early life to the time of birth, maternal thyroid hormone is available for the baby. As you see, then after 10 weeks again, in the D2, the iodinase type 2 and T3 is expressed in the cerebral cortex. T3 binding to the brain nuclear receptor starts in the in the early of the embryonic life and continue forever. Nuclear receptor in the brain, liver, lung, kidney are expressed in the embryonic life. And as you can see, during the after 20th week of the gestational life, thyroid hormone secretion start from the baby. And as I told you, uh, to the time of birth, the main source of the thyroid hormone is from mother. Therefore, if the baby was not able to produce thyroid hormone, there will be no problem. But and you can see the in the in the part C, you can see different part of the brain, development of different part of the brain that are dependent on the on thyroid hormone: striatum, neocortex, cerebellum, cochlea, glial cell proliferation, neuronal migration, neuronal proliferation, all depend on thyroid hormone. And this continue after the birth. You see that after the birth, particularly during the first year after the birth, the cerebellum cerebellar maturation is completed, myelination of the neurons is completed, synapse formation, axon and dendrite formation, all is continuous after the birth. And after the birth, there is no source for thyroid hormone from mother, and the only source for thyroid hormone is from the baby. This is the critical point. If we had a baby that has a problem in the thyroid hormone secretion after the birth, this will affect the maturation of the brain and maturation of the different area of the body, such as liver, lung, kidney. And those babies will be completely retarded persons, and the symptoms of mental retardation will happen. This figure show a normal baby and a baby with congenital hypothyroidism that was not detected. Therefore, the baby, you see that has a retardation in the growth, abnormal skin, abnormal skeletal development, abnormal brain development, and um, this show the severe effect that thyroid hormone deficiency will have on the development and the brain and body development. As the figure is saying, this baby is 6 years old in the left side, and this baby is 17 years old, but they are the same size. And this show how much it is important for the development. This 17 years old baby is equivalent to a one 6 years old. And when we look at the brain capacity, they are severely mentally retarded, that they are named as the cretinism. This is neurological cretinism that here you can see. Premature maturity, congenital hypothyroidism will make such problem to happen, and you can see the skeletal development that is severely impacted. For this reason, it is very critical for in different countries the screening of the babies that are born immediately after birth, after 3 to 5 days after the birth. All babies are instructed to be checked if they have congenital thyroid hormone deficiency or not. Because we want to know if the baby is have a problem in the thyroid hormone secretion, we can supplement with exogenous hormone therapy, and then this baby will have a normal growth like the other babies. But if we do not detect them, this will be the result. And for this reason, the screening programs are uh, checking all the babies when they are born. Just one explanation about why I told you that we wait for 3 to 5 days. Because after the birth, until 5 days, there are the thyroid hormone that come from the mother side still remain in the blood. Therefore, we wait for 5 days to allow this maternal derived thyroid hormone to be um, removed from the body. And then if the baby has a congenital hormone deficiency, it is easily detectable. The thyroid hormone function and effect is not just limited to the development and maturation during embryonic life and early life. During the whole life, it has several effects. For example, on the cardiovascular system, it affects the cardiovascular system either directly or indirectly. And you see that directly it stimulates cardiac muscle, myosin chain, myosin heavy chain ratio, sodium potassium ATPase expression, sarcoplasmic calcium ATPase pumps. And all these will affect the contractility of ventricular muscle. And all this will increase the contractility of ventricular contractility, peripheral, and decrease peripheral vascular resistance. On the other hand, indirectly, because thyroid hormone stimulate the heat production and the carbon dioxide production, decrease the vascular resistance, and decrease the diastolic blood pressure. All this will stimulate reflex adrenergic stimulation, and the adrenergic stimulation will stimulate heart function. What would be the result together? This all together will increase heart rate and cardiac output, and also blood volume. This is the normal function of the thyroid hormone. And those who are hyperthyroidism, this effect will be higher than normal. This figure shows how thyroid hormone therefore affected sodium calcium transporter, SERCA, ryanodine channels, and increased contractility and increased the heart rate, those effects that I told you about. On the muscles, thyroid hormone is essential for normal function of the muscle function, and make the muscles normally reactive and functioning. But if the hormone concentration increase to higher level in hyperthyroidism, it makes some muscle tremor in the patient with hyperthyroidism, and muscle weakness also will be generated. And in hypothyroidism, on the other hand, muscle do not work normally. They are relaxing slowly, and their activity time is decreased. Collectively, I can tell you that normal concentration is essential for normal function of the muscle. If in higher concentration, the muscle may be weakened and undermined, and the protein may be degraded as energy sources. Therefore, thyroid patient have atrophied muscle. On the other hand, in the hypothyroidism, muscle are not normally functioning because their metabolism is affected negatively, and they are less reactive. In the respiration, what is the effect of thyroid hormone on respiration? It increases the minute ventilation, because the need for oxygen is stimulated by the thyroid hormone. Therefore, the respiration will be stimulated. Hematocrit, that is responsible for moving the oxygen inside the blood, the red blood cell concentration and number will increase. Gastrointestinal motility is very dependent on the thyroid hormone's concentration. Therefore, I can say that those who have hypothyroidism, the motility of gastrointestinal system will decrease, and those patients have one typical symptom, and this is constipation. And on the other hand, severe hyperthyroidism can increase the gastrointestinal activity, and therefore even can cause diarrhea, different level of diarrhea. Endocrine glands and the function of other endocrine gland except thyroid cell also depend on normal thyroid hormone, because their metabolism depend on thyroid hormone. I can say that normal thyroid hormone is required for normal function of hepatic cells, adrenal cells, genital gland, the glands, and all these depend on thyroid hormone. And as you can see, and I wrote here, sexual function, normal production of gamete, normal function of reproductive system also depend on the thyroid hormone. For this reason, when we have a patient with endocrine disease, when we have a patient with infertility, the very first item that we check is to check if the thyroid hormone is normal or not. When we have a patient with a skin disorder, muscle disorder, we first check if the thyroid hormone is normal or not, because we know when the thyroid hormone is not working normally, then the function of the organ will be affected. And the first item that we should check is thyroid hormone. On the nervous system, I told you about the maturation of the nervous system and the effect that it has. But you should know that even when the nervous system is maturated, normal function of nervous system depend on the thyroid hormone. And there are several studies have shown that with impaired thyroid hormone function, neuronal system will not work normally. Hyperthyroidism increase sensitivity of neuronal system. They will be the neurons will be extremely active. Therefore, the sleep will be affected abnormally. Therefore, sleep will decrease. On the other hand, hypothyroidism will decrease neuronal excitability. Therefore, those hypothyroid patients feel sleepy all the time or less active. Normal level is important for the nervous system. Normal level is important for the sleep, not high level, nor low level is good for the thyroid cell. On the bones, production of bone, and other heart tissue, skin, all these cells need the protein synthesis to have a normal physiology. And again, the thyroid hormone concentration is required. Those who have a hyperthyroidism will have osteoporosis and problem in the skin and heart tissues. These all were a summary of the thyroid hormone function. And now the question is how the thyroid hormone is being regulated. The secretion of thyroid hormone, how the secretion of thyroid hormone is taking place. Thyroid hormone secretion is under the control of hypothalamus pituitary gland axis. In the hypothalamus, I told you before that we have a neuron named as TRH, and TRH releases a hormone that with the same name, TRH, and the TRH will affect pituitary gland, anterior pituitary gland, and stimulate a hormone that is named as TSH. TSH is the main stimulator for the thyroid cell to increase the release of thyroid hormones, and also increase iodide uptake and produce production of the new hormones. Then these three T3 and T4 that are released will feedback will have a feedback on the hypothalamus and pituitary gland to inhibit the release of more thyroid hormone. This is the negative feedback that I told you before. As you can see, some other factors such as dopamine, somatostatin, glucocorticoids also can inhibit the thyroid hormone secretion. And some other factors such as cytokines, inflammatory cytokine can stimulate thyroid hormone secretion. TSH that is released from pituitary gland is a glycoprotein that contain about 211 amino acid. It has, I told you, it has two subunit alpha and beta, and has a half-life of 1 hour. And it has a pulsative secretion that I told you before, that this pulsative secretion is important for not allowing the desensitization to happen. TSH increases all the aspects of thyroid hormone synthesis and release. Therefore, we say that increased proteolysis of thyroglobulin to release the hormone that are attached to the thyroglobulin. Increase the activity of iodide pump, increase the iodination of tyrosine, increase the size and secretory activity of thyroid cell, and increase even the number of thyroid cells. Those who have high level of TSH will have an enlarged thyroid gland. This figure shows the effect of the starvation. And as you can see, starvation, when we are starved and when we have limited food intake and we have limited metabolic intake, T3 is decreasing and instead reverse T3 is increasing. This shows that body has a sensor. When we have shortage in the metabolic intake, then we should be ready to conserve these metabolites and reduce the body metabolism. And this is one way that regulate the metabolism of the body. Those who try to limit their food intake, on the other hand, the body will compensate by reducing the metabolite usage. And for this reason, this is the reason why we do not lose weight when we are, for example, on a diet to that level that we expect. This shows that thyroid hormone is affected by the starvation. There are some other factors that affect the thyroid hormone synthesis, such as the inflammatory cytokine that I told you, particularly TNF. And at the end of this part, I want to tell you something about the disease of the thyroid hormone. I told you that we have hyperproduction of the thyroid hormone or hypoproduction of thyroid hormone, hyperthyroidism or hypothyroidism. In the hypothyroidism, for example, because of can take place because of several effects, for several etiological factors, such as dietary iodine deficiency, such as the problems in the production of the thyroid hormone, or any other reason. I told you that their muscle will be less active, they will be sleepy, the development of brain will be affected. If this shortage is during the developmental age, it is dangerous for the development. And in the adult life, it will cause a moon face appearance because of this hypothyroidism that is named as myxedema. And when we have dietary iodine deficiency, thyroid gland will be stimulated and enlarged to be able to uptake as much as iodine that is possible. For this reason, we have a goitre, and you can see in this figure how much the thyroid gland is enlarged. On the other hand, I told you about hyperthyroidism, the situations that for example, TSH secretion is abnormally increased, for example, in the adenomas, or because of the autoimmune disease, the cytokines, the inflammatory cytokine stimulate the thyroid gland, and in this situation again may increase the size of thyroid gland, but this time thyroid hormone is high, and this grave disease will have effect on all the part of the body, and as you can see, because of the enlargement that happened behind the eye will move out, and this state is named as a Graves' disease, and this is a figure of Graves' disease. These are losing weight, their nervous system is activated, and all the effect that I told you about the thyroid hormone function in the hyperthyroidism will happen. By this slide, and therefore, all the effect that I told you about hyperthyroidism, such as the effect that it has on muscle, that we have atrophied muscle, lose weight, increase neuronal activity, the problem in the neuronal system, problem in the endocrine system, all will be seen in the hyperthyroidism person or Graves' disease. In this patient, we try to reduce the production of thyroid hormone. In the hypothyroid patient, we try to increase thyroid hormone production or supplement the thyroid hormone exogenously. You remember I told you about the toxin that inhibit the peroxidase, inhibit the iodine uptake, and these drugs could be used as a tool to decrease the hormone production. Sometimes in severe state, we remove some part of the thyroid gland from the body to reduce the thyroid hormone production. Sometimes radiation therapy will be done to reduce the thyroid hormone production in hyperthyroidism. And in hypothyroidism, as I told you, the supplementation or stimulation of thyroid hormone secretion could be employed to treat these patients. We should firstly diagnose if the hyperthyroidism is primarily because of the hyperactivity of the thyroid gland, or it is secondary because of hyperactivity of the pituitary gland, or it is also tertiary because of the activation of the hypothalamus, and then design the treatment. On the other hand, for the hypothyroidism, the same principle should be used if it is primary, secondary, and accordingly the treatment should be designed. By this slide and these explanation that I told you about the thyroid hormone and the functions of the thyroid hormones, I am going to finish this part, and in summary, I can in this section, two part of the thyroid hormone, I told you about the principle about the thyroid gland, how the thyroid gland balance the iodide uptake, the process of iodide uptake, and the balance of iodide uptake, iodide metabolism was discussed. About the production of thyroid hormones, how it is produced, how it is stored, how it is released, how it is transported in the blood. I told you about the transporter for thyroid hormone, and then I explained you about the function of the thyroid hormone very briefly, because you know that we have not enough time, and I want to maintain the length of this file manageable. Therefore, I just brought you some summary of the effects and showed you some diseased state about thyroid hormone. In one sentence, I can say that thyroid hormone is a essential hormone for the body, not just during the development that you saw the result, but also during the whole life. and normal function of thyroid hormone is a precondition for a normal physiology. I hope this chapter, these two sections that I told you about thyroid hormone, was informative for you and help you to better understand the physiology of endocrine system and physiology of the body. In other sections, I will talk about the other main endocrine glands, such as adrenal gland, pancreas, and other gland that we have in the body. Until that time, that I will discuss about other endocrine gland. Take care and have a good time. Goodbye.